Meet cancer survivor Dave Williams as he discusses his long journey with cancer. Learn how Hermes Klippa and Betty Vieira, Dave's expert care coordinators, use their clinical judgment and assessment skills to develop a personalized care plan to ensure Dave's healthcare needs are met.
Dave had a very advanced cancer, and as a result of that, actually, they've been able to remove part of his colons, and he had a colostomy, and there were multiple surgeries. And not only that the colostomy has been changed to an ileostomy, which is a different type of procedure, but there were also very extensive surgeries being done in the hospital just to keep him alive. He came back home and he was on weeks and weeks of IV hydration. He had different tubes and drainages, and at one point 3 different bags that were being changed. This battle with cancer that he had, that was a very extensive and a very painful one too.
The expectation was this would be a short journey, and 2 years is not a short journey, particularly with multiple hospitals visits, triple surgeries, major complications. You need more than just someone managing what resource should show up.
Definitely you can call me at any time, and we will be able to set up the equipment and supplies as been done previously.
I've come into Dave's care towards the middle to the end of his journey. Hermes was the care coordinator that initially started off with Dave in his care plan. I was introduced to Dave and have continued on with his care.
One point that comes to mind is because of the complication of dehydration during the treatment program, I was here in not a really good emotional state. And surprisingly, the nurse decided to call the care coordinator. And this telephone conversation that I had was amazing, because that wasn't an administrator talking to me. That was someone with a medical background who knew what was required and had some skills to get me to see another perspective. If I hadn't had that phone call, I don't think I would have survived much longer. I was in pretty bad shape, and I wasn't handling things that well and needed that extra support. You'd call another one of those life-saving interventions. But in hindsight, without that care coordinator managing the process for the things that were important to my survival, I would not have made it through this journey. There were far too many complications. Literally 3 times I faced death. Without that home care support and that care coordinator managing the process, when you're in that dark of the night, it's pretty scary, and you have to lean on someone, and that's the team that I had around me.
I feel that I'm able to explain to the patient what they're going through in simple terms so they can understand, and just make them feel cared for, not just like they're a number or they're a statistic. Their opinion matters, and involve them as well.
I can't believe over 2 years now, I'm actually getting back to being finding my new normal for my life.